Hello everyone, welcome back to my channel. So today's topic is anemia. Anemia is the most common blood disorder. Anemia occurs when you do not have enough red blood cells or your red blood cells do not function properly. It can be diagnosed with a blood test which shows a hemoglobin value of less than 13.5 grams per deciliter in a man or less than 12 grams per deciliter in a woman. Red blood cells carry hemoglobin, which is an iron rich protein that attaches to the oxygen in the lungs and carries this oxygen to the tissues throughout the body. When you have anemia, your body lacks oxygen, so you may experience one or more of the following symptoms: weakness, shortness of breath, dizziness, fast or irregular heartbeat, pounding or whooshing in your ears, headache, cold hands and feet, pale or yellow skin, and chest pain. Many people are at risk of anemia because of the poor diet, intestinal disorders, chronic diseases, infections, and other medical conditions. Women who are menstruating or pregnant and people with chronic medical conditions are most at risk for this disease. The risk of anemia increases as people grow older. Now let's talk about common types of anemia. The first is iron deficiency anemia. Iron deficiency anemia is the most common type of anemia. It happens when you do not have enough amount of iron in your body. So this iron deficiency anemia is usually due to blood loss but may occasionally be due to poor absorption of iron. So during pregnancy and childbirth, consume a great amount of iron and thus can result in pregnancy related anemia. People who had gastric bypass surgery or for weight loss or any other reason may also be iron deficient due to poor absorption. The next is vitamin deficiency anemia, and this type of anemia may result from low levels of B12 vitamin or folate, also known as folic acid, usually due to poor dietary intake of less iron in diet. Next comes the pernicious anemia. In this, which is a vitamin B12 cannot be absorbed in the gastrointestinal tract. The next is aplastic anemia. It is a rare disorder in which the bone marrow stops making enough blood cells, and this leads to the results of destruction or deficiency of blood forming stem cells in your bone marrow. In particular, when the body's own immune system attacks the stem cells. However, the few blood cells that bone marrow make are normal viral infections. Ionization, radiation, and exposure to toxic chemicals or drugs can also result in aplastic anemia. The next is hemolytic anemia, and it occurs when red blood cells are broken up in the bloodstream or in the spleen, and the causes are mechanical causes, infections, autoimmune disorders, or congenital anomalies in red blood cell. Inherited abnormalities may affect the hemoglobin or the red blood cell structure or function. Examples of inherited hemolytic anemias include some types of thalassemia and low levels of enzymes such as glucose 6 phosphate hydrogenase deficiency. Sickle cell anemia, this is also a type of anemia, and it is an inherited hemolytic anemia in which hemoglobin protein is abnormal, causing the red blood cells to be rigid and clog the circulation because they are unable to flow through small blood vessels. Hope you like this video, and please do not forget to like, share and subscribe to my channel and hit the bell icon. Thank you so much for watching my video.